My name is Emelin Lagunes Cordova. I'm a Mexican psychiatrist and psychotherapist, but currently working in the UK. I work in a crisis team. I think we have had two main challenges. One, which is the first one, which is the one that I think most people, struggle with during the pandemic, was the lack of enough PPE. However, that has been resolved, and currently we have more than enough for us to be able to see our patients. But the other main challenge was at the beginning, people were getting ill, and we were not sure if we would have enough staff to cover patients or to work with the patients within our caseload. So every day you will arrive at work knowing that another colleague was ill, or not knowing if you would have enough staff for you to be able to see all the patients. Luckily, not everybody got ill at the same time. Every day we were able to, meet with the demands and see all the patients in occasion. My service has definitely tried to, improve our well-being, or at least, do things to check that we are coping with the demands, are coping with the stress. I think one of the most significant one, as is one that we have every day, is since the beginning of the lockdown, the staff start providing us with free lunches and free treats like chocolate, biscuits, cakes. Some of them donated by the sponsors or different organizations. Some of them provided directly by the trust. But until this day, everybody look forward for lunch to get to know what we're gonna have for lunch today. It's gonna be a curry. It's gonna be a burrito. Sort of things that they have helped us more out and improve the cohesion of our team. Another one has been flexibility for some people to work from home. I have a couple of colleagues that have chronic illness and they should not be exposed to COVID for the likelihood of they getting complicated. So they have been allowed to work from home, which I think is very good. And the other one is the trust also because at the beginning of the lockdown, there were very few people in the street. So for those who had to work the late shifts, Trust can organize free transportation for people when they leave the workplaces. They could be taken back or go back to their homes safely. The other one, the Trust also provide free accommodation. There are some people that they have in their household, or elderly members, or people with chronic illness that should not be exposed to COVID. So until this day, I have a colleague that has been for the last 2 months staying in a hotel paid by the organization, which I think is hard for her, and it's a sacrifice. But us to be able to have that opportunity, or the trust supporting people in those conditions, I think it has been very good. In my experience, I think this kind of recognition of our hard work has been very good. And I mean by recognition, from having an email saying, thanks for doing what you're doing, to having these little treats or these little, these free lunches or these things, to remind us that we've been taking care, that really puts morale and, help have a nicer environment within the workplace. But another thing that in my experience has been very helpful is to have more direct contact with my manager, or at least more frequent. My manager, which is a consultant within my team, has every time that we meet, he always asks if I'm fine. He always really asking me, are you able to cope? Is there anything I can do? Is there anything that we can do? He has offered me to, if I need to arrive later or leave early, I can do that. If I want to take one day off for me to, to have a break, he has offered to do that, which I really, really value. Luckily, I have not need to do this, and I have been able to cope. But to know that if I start struggling, or if I need it, I can go with me, or I can just say, can I take a day? Can I leave early? And everybody is trying to make the most this. Everybody's struggling. So to know that, I have the support from my team and from my managers and my, and my trust is, I think it's very rewarding, and make me want to do my best.